Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. Today on HITshow, a major health system expands its innovation partnership with General Catalyst. Federal lawmakers move to extend telehealth and hospital at home, and SNAP cuts put pressure on food as medicine programs. After the break, we'll cover new rules on prescription drug price transparency and Evernorth's $3.5 billion investment in specialty pharmacy. We begin with a bold move from WellSpan Health. Logan Stokes has the story.
WellSpan Health is deepening its collaboration with General Catalyst Health Assurance Transformation Company, or HATCo. The expanded partnership will focus on AI-driven solutions that could reclaim 400,000 clinical hours annually, while improving outcomes and operational resilience. Executives say the goal is to reimagine care delivery and scale digital-first models that help clinicians spend more time with patients. This move builds on their 2023 partnership with General Catalyst and signals a growing role for venture-backed innovation inside health systems.
Logan, how significant is this for hospitals looking at digital partnerships?
It's another sign that big health systems are moving past pilots and into scaled platform partnerships, often with outside investors playing a central role.
Thanks, Logan. Lawmakers in Washington are moving to extend two pandemic-era programs. Anika Shah has more.
A new bipartisan proposal, the Telehealth Modernization Act of 2025, would extend Medicare telehealth flexibilities through 2027 and the CMS Hospital at Home waiver through 2030. Both programs were set to expire at the end of this month. Hospital and provider groups have pushed hard for extensions, saying they've become essential to access and capacity. If passed, the bill would give hospitals and patients more stability in planning care models that rely on telehealth and virtual acute care.
Anika, what's the main sticking point in Congress?
Lawmakers are debating cost offsets and safeguards against overuse, but support is strong on both sides of the aisle.
Meanwhile, social determinants of health programs are facing challenges. Teresa VaughnSNAP has that story.
With SNAP benefits facing reductions, food as medicine initiatives are under pressure. These programs, which link prescriptions to fresh produce and medically tailored meals, depend on stable food assistance funding. Experts warn that cuts could slow adoption just as health systems are ramping up nutrition-based interventions for patients with diabetes, hypertension, and other chronic conditions. Lower-income patients who rely on both SNAP and clinical food support could be hit the hardest.
Teresa, what does this mean for hospitals investing in food as medicine?
It means tougher economics. Hospitals will need to find new partners or funding streams if they want to sustain these programs at scale.
Thanks, Teresa. When we come back, new transparency rules for prescription drug pricing and a major investment that could reshape specialty pharmacy. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
Welcome back. The federal government just took a big step toward drug price transparency. Jade Romero has that story.
That's right, Rhonda. The Department of Health and Human Services has finalized a rule giving prescribers and patients real-time access to prescription drug pricing. Starting October 1st, clinicians using certified health IT systems will be able to compare the most affordable, clinically appropriate medications during patient encounters, see prior authorization requirements instantly, helping avoid treatment delays, and access this data via EHR workflows, not external tools, so transparency is embedded and seamless. This is a big shift in how we handle prescribing. Instead of relying on outdated formularies, docs can present lower-cost alternatives right at the point of care. HHS is showing that this could cut billions in administrative burden and free clinicians to spend more time on actual patient care.
Jade, from the hospital leadership perspective, what challenges and benefits should they be thinking about?
Great question. On the upside, hospitals and health systems can improve medication adherence and reduce pharmacy denials, and fewer callbacks means smoother discharge workflows. The catch? It puts pressure on EHR and IT teams to implement this with minimal disruption. Also, Vigilant monitoring will be needed to ensure accuracy of pricing data and maintain compliance when prior authorization is pushed through this new channel.
Thanks, Jade. Finally today, a major play in specialty pharmacy. Peter Betterworth has more on that story.
Cigna's Evernorth Health Services announced a $3.5 billion investment in Shields Health Solutions, which partners with hospitals to run their specialty pharmacies. The deal expands Evernorth's reach across more than 80 health systems and strengthens its control over one of the fastest-growing areas of drug spending. Specialty drugs now account for more than half of U.S. drug costs, making this investment a strategic bet on future growth.
Peter, how will this affect hospitals working with Shields?
It could give them stronger infrastructure and negotiating leverage, but it also tightens Evernorth's grip on specialty pharmacy economics, something hospital leaders will need to watch closely.
Thanks, Pete. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.